Hello, and welcome to another episode of the IBMS podcast. I'm Rob Dabrowski, the editor of the Biomedical Scientist magazine, and in this instalment, I'm joined by Pathology Practice Educator, Mehwish Khalid. The discussion covers an array of areas from workforce planning and future challenges to how artificial intelligence can be embraced and increasing the profile of the profession. I hope you enjoy the episode. Hello, and thank you so much for joining us today, Mehwish.
Thank you so much for having me.
Pleasure. Let's jump straight in and go right back to the start of your story. Can you tell me when you first kind of realized you had an interest in science or biomedical science, whether that was a kid, a teenager, or an adult? When did you first get an interest?
I've always been fascinated by science. In fact, one of my favorite cartoons growing up was Dexter's Laboratory, so I think that says quite a lot. And I've always, as a child, enjoyed science experiments and was naturally drawn to biology and understanding how the human body works. As I got older, I realized I just didn't enjoy science for the sake of it. I wanted a career where I could actually use science to make a difference to people's lives. Healthcare really appealed to me, but I have to admit, I wasn't completely sure which direction to take after college, because there are so many different healthcare science careers. I decided to study biomedical science because it combined everything I enjoyed: science, healthcare, and problem solving. And I absolutely enjoyed the degree, particularly the research side, which inspired me to go on and complete a master's in research degree. And at that stage, I genuinely thought I was going to pursue a career in research and eventually do a PhD. But while I was studying for my master's, I took on some bank work in a pathology laboratory to gain practical experience. That was probably the turning point in my career. It was the first time I had experienced what a real diagnostic lab looks like, and I got the opportunity to work alongside biomedical scientists and see the impact that they have on patient care every single day. And I was really fortunate because I worked with colleagues who encouraged me to do my registration portfolio and pursue a career as a biomedical scientist. So the more time I spent in the lab, the more I realized that this was exactly where I wanted to be.
So it was kind of the impact you could have on a patient's life, as opposed to, I suppose, in research, you don't get that kind of direct impact, do you? And what was your first job in biomedical science? So you've done your degree, you've done your master's, started doing a bit of work in a lab. Talk me through what happened next, Mehwish.
Yes, sure. So I was working as a medical laboratory assistant in specimen reception, and I also had the opportunity to rotate through other departments such as blood transfusion. And that's really where I had more of the opportunity to work alongside biomedical scientists. I was then able to make a start on my registration portfolio while I was working as a medical laboratory assistant. And halfway through the completion of my portfolio, an opportunity came up to work as a trainee biomedical scientist. So that was my next role. And immediately soon after that, I was able to complete my portfolio and work as a HCPC registered biomedical scientist.
Sorry, and what specialism were you in, sorry?
So clinical biochemistry, that's where I've really built my foundations as a scientist.
Was that an area that particularly appealed to you, or was it just that was where the opportunity was at the time? How did that come about?
So interestingly enough, at that time, there were two positions to work either in clinical biochemistry or hematology and blood transfusion. But because I had a lot of experience rotating through the different areas while I was working on bank, for some reason, clinical biochemistry attracted me more. I still don't know exactly what. I enjoyed hematology and blood transfusion as well, but something about clinical biochemistry. Maybe it was the highly automated lab that attracted me to it. Also, the colleagues, I really enjoyed working with them, the training that they gave me, the mentoring support I had from them. So I think all of those had a role to play in helping me make up my mind in regards to which discipline I wanted to work in.
Was it quite a valuable experience working in bank where you got to kind of rotate through all these different sections?
It is. And at the time, I went for this opportunity, not really realizing it's probably one of the best things that's happened to me, because without that exposure, I didn't really fully understand what a day-to-day job of a biomedical scientist is, and if that's something I want to do for the next few years of my life. So having that opportunity really helped me understand things, and also really speaking to the professionals in that field and getting their encouragement. All of those really helped me feel more motivated. And that was the first time I really knew exactly what I wanted in terms of my career.
It must be quite useful as well, because traditionally biomedical scientists have kind of worked in quite a siloed way where, each lab is kind of buried in a different place in the hospital, and they all kind of do very different things. Was it interesting to, as someone who's starting out in your career, kind of go into the different labs and see all the different processes, and maybe valuable for later on in your career where you can see how all the different labs work and kind of fit together?
That is very true because I understand this is not the reality in every single lab where you would get to receive multidisciplinary laboratory training. So I did get very lucky at that time that my seniors were very supportive of me rotating through different sections of the lab so I could start to gather evidences for my registration portfolio. And that's something that's really helped me understand how all the different functions come together to provide those high quality services to our patients on a daily basis.
Oh, brilliant. And let's pick back up on your journey through the profession. So what happened after your registration portfolio? That's all done. What happened next, Mehwish?
So after that, I started to gain a lot of experience in clinical biochemistry. So started to rotate through different benches, and I made a start on my specialist portfolio because I already had a master's at that time. I was able to secure a job as a specialist biomedical scientist, and while I'm working as the biomedical scientist, I started to realize how much I enjoyed helping other junior members of staff, whether it was in regards to their training, mentoring support. We also had a few students working with us in the lab, and I really enjoyed giving them the extra support that they needed to make sure they're getting all the right training and all the right evidences for their portfolios. So really, training and development is something that I started to develop a strong interest in, even as a specialist biomedical scientist. So I knew my next step in the career would be to work as a senior biomedical scientist, and I was almost leaning towards a training and development focus. Fortunately, a job did come up as a senior biomedical scientist in training and development as a training officer, and I went for that job, which I absolutely loved. After that, I decided to become a lab manager in clinical biochemistry. I did that for 4 years across two different pathology organizations. And I did really enjoy that. I just loved managing the labs, staff. At one point, I was managing 60 different staff members in a laboratory. It's certainly a very challenging role because every day there is a lot of problem solving to do. And I absolutely loved that. One day, an opportunity came up that I couldn't decline, the practice educator role. And these roles were introduced by NHS England in 2021. This was as a follow on from the impact COVID-19 pandemic had on our services. And one good thing that came out of that was since COVID, there was a lot of focus on the great work that pathology services do. And also, there was a lot of recognition of the important work that people do behind the scenes to make sure we're able to provide these services. So, yeah, this was a very unique opportunity. Instantly, we knew there's going to be a national pathology practice educator network, which sounded really exciting because for the first time, we would be looking at training and development and approaching a lot of our similar sort of workforce challenges in a very collaborative manner rather than organizations working in silos to try and solve these problems on their own.
So what was it like coming into a job that didn't exist before, 2021? They introduced the role. You can't look at the people who've worked in that role previously and say, oh, this is what they've done. I'll copy that and do it differently. Was that a daunting challenge? Is that something you relished? How did you feel about that?
Certainly very challenging. We did have a job description, but it was very basic at that time. So the first group of practice educators who were recruited into these roles across the UK, we were told that you will play a very important role in shaping what this role looks like. And that was very exciting. We got our heads together. We worked on a national piece of training needs analysis to try and identify, if there's any themes and patterns in terms of the bigger problems or issues that we need to prioritize and start looking for solutions to, address those challenges. I think it was such a great experience. When I look back now, it really helped me gain a better understanding of how to do a strategic role in workforce training and education because I was involved from the very first day and I was part of those very first initial conversations.
Was it strange to jump from being in the lab and managing labs to kind of having this almost like an overview kind of role where you're looking at the bigger picture? Was that a strange or hard jump?
It was very strange because I had worked as a training officer. I was involved in delivering training on a day to day basis. You are making an impact to your colleagues, to your workforce, but at a much smaller level, maybe at your departmental level or your organizational level. And here we were working as a collaborative group, trying to figure things out to make sure we can have an impact at a national level. And together we could have a stronger voice to try and influence, also really raise the profile of pathology. So while it was very interesting and new, it certainly felt like such a new world that I found myself in. But I think that is something that's really hooked me onto this role for so long because it never really gets boring. And each time we're growing our network, we're growing our connections. We work closely with NHS England, universities, schools, colleges, other healthcare professionals, Institute of Biomedical Science, we work closely with as well. So our network is always growing and expanding, and we're learning more and more about the opportunities that are available to us to really try and influence and make an impact at a much wider scale than what I have been used to before.
And how many people were involved in that first cohort of practice educators? Kind of how big was that network? And was that England? Was that the UK? What kind of geography did that cover?
It was England, but because it was such a new role that was being advertised for, not many regions had started to recruit at the same time. So the first cohort, I believe, was about 10 people. I was the first practice educator who was recruited into this role from London. Shortly after that, joined me a couple of other colleagues. So yeah, there was three of us from London, and then the other seven were from different parts of England. Eventually, we did have a colleague join us from Wales as well. While we don't have practice educators in Northern Ireland and Scotland, but we do try and work closely with them and we have contacts. We try and make sure we're sharing our resources on the Future NHS platform and really learning from each other as much as we can.
And presumably, because it's a new role, you're kind of liaising with these people in the same network. You can't just hit the ground running and kind of immediately be like, this is what I'm going to do, this is what I'm going to do. How long was that process where you're kind of looking at the challenges and deciding what the potential solutions could be before you can actually start doing any actual work?
I think one of the biggest challenges was getting the buy-in because colleagues from across the different networks didn't really understand what these roles are, what they're meant to achieve. And we're trying to not only make ourselves known to all the stakeholders, we're also trying to, get them to engage with us, which does require time commitment. So the initial piece, which I talked about, training need analysis, gathering that very important data, building that relationship so they would trust us to, share that information with us, and then for us to be able to deliver on those things. We just got very fortunate because as the data was starting to emerge, we found that specialist portfolio training was one of the areas that needed the more urgent attention at the time. So the London practice educators decided to start an initiative where we could put together resources delivered by our subject matter experts from different organizations and delivering on webinars which are aligned to the learning outcomes of the specialist portfolio. So, what started as a London pilot at the time, one, it helped us reach out to different colleagues across the different networks and really help us make those connections. But two, it really helped us see the impact this collaborative approach was starting to make on the learning journey of our trainees because we were collecting feedback at the end of each session. And before we knew, the word spread, and then the colleagues from other regions also wanted to have access to this initiative, which meant more people wanted to join us in delivering this. And that meant in a very short period of time, we could start to use the Biochemistry London Specialist Portfolio Program as the blueprint for all the other disciplines. And within a year, it became a UK-wide initiative. So that really was a great success story. And it really helped us gain the confidence and to showcase to our stakeholders there is a lot of value in us working together to try and solve these challenges.
And what were the issues with specialist portfolios that you needed to deal with? Why did you have to launch this pilot project in the first place?
Yes, that's a very good question. So, one of the biggest challenges we face in pathology is having protected training time for our trainees and markers, training officers. And while the labs try their hardest to give some protected time, it's not almost nearly enough. So what we wanted to do was once we got hold of the data, we started to see how there was a lack of resources that our trainees could access. And because there is a big component, a big knowledge component of the specialist portfolio that the trainees are expected to cover as part of their portfolio, we decided to pull together all these resources for them. And if we had the right people in the room who knew that area and who could really address all the different topics within the portfolio, would mean they're not only helping save time for the training officers and the individual organizations to try and put those resources together, but we're also delivering a very high quality content to our staff.
Was it a battle to get that in place? Because if you look at the typical lab, they're just kind of, we're trying to get our turnaround times down and, it's just focused on what's on the bench right in front of you. And it must be a challenge to say, can we do things a bit differently? And it might not be a short-term, immediate kind of everything's improved, but over time it will. Was that a challenge?
It was a challenge. Time came up a lot. So when we were reaching out to the different stakeholders to say, we know you're an expert in this area, we would like you to cover this particular module for us, and we would need an hour of your time to deliver the session, and there's some preparation work or preparation time required. A lot of the times we would hear back from them saying, we're too busy, we don't have time for this. I think at that point, we were starting to feel a bit disappointed because ultimately this would save colleagues a lot more time in the long term. But it's getting people to see that and provide them with an evidence for that. So we made an executive decision at that time to launch this program while we only had 2 speakers secured.
Mhm.
So we started to get the flyers out, started to get the word out, and we knew the minute people started accessing these webinars, they would be able to see the value in them and hopefully they would want to be a part of them. And that's exactly what happened. So as time went on, we had more and more people. A lot of the times, it wasn't even us approaching the speakers. We would be hearing from people from other networks who might have seen our flyer on the LinkedIn or another social media channel and who really thought this was a great initiative. Quite a few times we had trainees going back to the training officers or managers and telling them about this webinar they attended and how useful they found it. So the good word really spread very soon, and that really helped us. But it wasn't easy to begin with.
Yeah, it must have been some scary moments where you just got 2 speakers confirmed, you're sorting out these flyers, you're pushing forward, and you must have been thinking, if this doesn't work, then, what do we do?
That's right. And actually, there were a couple of occasions where at least one of my peers who was working with me to put these together would say, maybe it's not going to work. Maybe we can start working on something else. I always had a strong gut feeling that this was such a good initiative, and this is something we really needed to resolve at the time. You have to start from somewhere, and I think I managed to convince them at the time to say, why don't we give it a go? Even if you just give it a go with 2 speakers, if things don't work out, maybe the attendance is too low, people don't find it useful because the feedback indicates so. That's good enough evidence for us to make this decision in terms of, it's not going to work. Let's try something else. But fortunately, that wasn't the case, and the feedback was very positive. It probably even took us by surprise how positive the feedback was, considering it was just starting out. We were able to make improvements as we went along, But even to get such positive remarks from the first couple of sessions was incredible.
And how many people were you having at these first couple of sessions? Is it something where you would have a handful of people at the early ones and then it grew and grew? And was there a limit to the amount of people you could have on these webinars, or was it just kind of as many as you can cram in there?
There was no limit, actually, but because in the beginning we would only reaching out to the trainees across the 5 different pathology networks in London, I would say it probably started off with something like 30 trainees attending. Just to show you just how the numbers have grown over like a year, we started to upload these webinars onto the Future NHS platform because, in terms of ease of access, the NHS organizations and the private organizations could both access the resources on this platform. So after a year, when we looked at the membership numbers, it went over 1,000. And so there's been a huge drive in the membership to join our pathology workforce development workspace, and looking at the different folders which contain these resources and how many people were coming in and out of them really showed us how much of an impact it's having at a much wider scale than what we set out to achieve.
You've mentioned some of the stakeholders that you had to work with, kind of the IBMS, NHS England. I mean, was it a tricky role where you're not just focused on one thing? You've got these multiple stakeholders that you've got to kind of get on board, keep happy. How do you deal with that aspect of the job?
So the IBMS support was very, very beneficial. We never really had to work hard for it. I still remember our initial conversation with David Wells and Donna, and we proposed this idea to them, and they were instantly on board. They could see the value this would bring to the trainees, and they even suggested getting the IBMS specialist advisory panel members on board so they could review the content before these were uploaded. And that would give our stakeholders the assurance that this has the stamp from the IBMS, that this content does in fact align with the learning outcomes, and it does deliver high quality sessions. So that really helped. NHS England again really supportive of this. I would say even the organizations we worked with, once they did understand about this, they all got on board and they really helped because we could start to see how, if we have a 1 month program planned out, we had a variety of speakers from different organizations. Some of the speakers would want to come back and join and deliver on another session again. So I think having that early support from the IBMS, NHS England, and some of the initial organizations that did see value in this really helped push this forward.
And also, did your MA in research come in handy here? Because you mentioned a few times kind of evidence, data, presumably as well as your management experience in labs, that a kind of MA that you did and then didn't go forward in that direction actually have potentially become a very beneficial thing for your work.
Yeah. I think being a biomedical scientist myself, when it comes to registration portfolios, we all know you cannot start working as a HCPC registered biomedical scientist. So there is a lot of motivation when it comes to the trainees and the markers and ensuring people can complete that journey. But when it comes to specialist portfolios, some organizations probably don't find it as important or they don't think it's as necessary. So, being a scientist myself and being someone who started it, and I still wish I actually finished it because it was something that really helped me improve my knowledge and skills. Also, as a lab manager, I understood the importance of supporting this qualification. So, all of that combined together. And then, when we looked at the training needs analysis from across the London region, we could see it wasn't just a problem associated with one organization that I was working at the time, but it was a regional problem. And then, speaking to my other colleagues from other regions, other practice educator colleagues, we were hearing the same thing. It was the same problem that we were facing, that we are very limited in terms of time. And for that reason, specialist portfolio qualifications are probably not getting the kind of support that they need. So we all agreed on this one thing. Something needed to be done to change that.
I think it's great to have that kind of big overview because traditionally, different trusts, every trust is different, every lab is different. and they kind of work away on their own and potentially don't realize that there are these kind of big overarching issues that are the same in every single lab. Because in the past, biomedical science as a profession maybe hasn't been great about sharing evidence of what they've done in individual workplaces. So I think that's an absolutely fantastic thing to have done. It must be a great way of influencing stuff and ensuring the best outcome for scientists and ultimately patients as well.
Thank you.
Which other challenges have you faced and looked at other than kind of the portfolios? Are there other areas you've been going into, or is it mainly focused on the portfolios?
Actually, my role involves looking at all the different aspects of training and development. So, if we talk about the other challenges, I think one of the most important things that we have to think of as the practice educators is ensuring we have the workforce that pathology needs, not just today, but for the future as well. So we have to think about the whole career journey from attracting people into the profession, supporting students and apprentices, helping biomedical scientists complete their registration specialist, right through to developing future leaders. A big part of the role is also working with universities, colleges, and professional body to make sure the education our future workforce is receiving reflects the skills that laboratories actually need. At the same time, we're looking at workforce challenges such as recruitment, retention, succession planning, and creating clearer career pathways so people can see a future for themselves within the profession. It's really about developing a sustainable workforce that can continue delivering high quality patient care.
Yeah, that must be really tricky because when you're looking at what the profession needs, you're kind of not looking at what the profession needs now, but what it will need in a few years' time once these students are kind of gone through the system. And if you look at, for an example, outside the profession, if you look at a few years ago, everyone was talking about how vital coding was. And there were loads of kids who were kind of learning to code, and that's the future, and that's where everything's going to be. And then AI comes along, and it's like, oh, basic coding isn't needed anymore. You can just get AI to do basic coding for you. And, what was thought to be the future is no longer the future. I mean, do you have to have many discussions around that? And how do you figure out what will be needed in the future when it's not necessarily what is needed right at this minute?
That is certainly something that we're very aware of. I think it is one of the biggest challenges to prepare for the future because healthcare is changing rapidly. So whether it's the advances in technology, digital pathology, artificial intelligence, we need to make sure that our workforce is equipped with the skills they'll need tomorrow, not just the skills they need today. And it's really making sure, are we delivering the right training to them? And are we delivering it in a way that is going to help support their learning? So, AI is another developing area, and it's how we really look into making sure people make the right use of AI. So, at the minute, we hear about, again, going back to challenges, the misuse of AI. So, when it comes to using it to create your answers for your portfolio, or sometimes we hear from the universities that students are starting to use AI. So it's really educating our workforce and even more importantly, our future workforce now, so they can understand that AI is supposed to be your research assistant, but it should never really replace your thinking and your knowledge because you will always need that once you start working as a professional. So, really educating people, and I think having some CPD done on that. I know IBMS has already done a couple of really good webinars on the use of AI, which is what we've been signposting our staff to. But I think it's a conversation that shouldn't stop. We need to continue discussing the good and the bad use and how we can make sure our trainees and staff are comfortable in using it in the right manner.
And if it's not too broad or challenging a question, what do you think the main positives and the main kind of negatives or challenges around AI are moving forward?
So, if I can use one of the examples, we're currently working on a research project which has been funded by the IBMS. What AI has really helped us do is narrow down the places where you would go and look for data. So, when it comes to your literature review, etc., we're literally using it as a research assistant. A lot of the information that you get you have to filter it down yourself. You have to apply your own thinking. But what you can do is, because there's such a vast amount of information available out there, it's knowing how you can use AI to help you direct you to the right sort of places and get to the right information. Certainly, the bad users are where you are fully reliant on AI to an extent that you don't understand what you're about to do, which can be very dangerous in our profession because ultimately the work that you do is having an impact on patients. So you need to have the right level of knowledge and competence. So it's really finding the right balance with AI.
Do you think it could lead to a place where we've got AI can be kind of quite liberating potentially, and it can take away a lot of the mundane kind of predictable work maybe, and then that will lead to kind of more specialization and people with more specialized skills kind of overseeing the AI? I mean, which direction do you think we're going in, Mehwish?
That's a very good question because we do know a lot of the time we spend in the labs is basically doing admin work. So, whether we're in corporate roles or we're working as scientists on the bench, a lot of our tasks are very admin heavy. So, using AI to save us that time so we could then get our workforce to focus on more of the tasks that do require their skills and knowledge. Time is always a challenge, and we do know about our staffing challenges. So it's how we use AI to make sure we can release and create those opportunities for our workforce to not spend their time on tasks that they probably find too repetitive, boring, and reshifting the focus.
And can you also have an impact on areas of the profession where there might be staffing shortfalls? Say, for example, there are a load of histopathologists who are quite old and are soon to retire. Does the system work whereby you can kind of influence the path early on and say, right, it looks like we're going to need some more histopathologists in 5 years' time, so we're going to try and push people further down that route? Or is that not part of your role?
So, workforce planning is certainly a part of our role, and it's really making sure how we utilize all the information we have to hand and start looking at the future changes, start anticipating now the future problems. And it's really how you get together with your management teams to really think about how we can also influence the organization strategy to make sure we're focusing on the right things to make sure all those challenges which await us in a few years' time, we're well prepared to deal with those challenges. And our workforce is well equipped with all the right skills and knowledge to be able to deal with those challenges. It's not always the easiest thing to answer, and it can be very time consuming, but I'm pretty sure this is one of the most important areas that we need to be investing our time and energy in to make sure we're starting to do the things now for the future.
And are there any particular workforce challenges that you're doing now, kind of looking to the future, that you could kind of talk us through a little bit?
Yes, sure. So I think one of the biggest areas of focus right now in my current organization, and I know my colleagues across the country as well are focusing on this quite a lot, is how rewarding biomedical science is as a career, but still relatively unknown compared with many other healthcare professions, despite all the great work we're doing in terms of outreach. But still, we find there's a lot of young people who don't know we exist, and they can't choose a career they don't really know much about. So it's about raising the profile of the profession and inspiring the next generation, and also doing it in a way that they find this career worthwhile. So again, letting them know about how pathology is evolving as a profession. So letting them know about digital technologies, automation, all those changes, so they can really see them being very much interested in AI and digital technologies, that this career is something that would still align with their interests. Also, looking at the retention side of things, developing or growing our own workforce, we're starting to see there's a lot of focus on T levels, apprenticeships, so we can really have like a strong pipeline. That's one of the areas we're working very closely on. And really, it's just about looking at other interesting apprenticeships. So there's now data apprenticeships, there's AI apprenticeships, encouraging our workforce to take up these learning opportunities so they can understand what is required of them and how they can implement this technology into their day-to-day role and really make a difference. I think you mentioned earlier as well in terms of like saving time through the use of AI, etc. So we can't really achieve that unless our workforce feels comfortable and knows exactly what tools are available to them for them to be able to implement and make improvements in their day-to-day role.
With the profession, the kind of profile of the profession and raising that, you say that these roles came about kind of just after the pandemic?
They did, yes.
Yes. Which must have been very handy, because I think before the pandemic, very few people knew who biomedical science were and what they did. But did the pandemic in some way kind of raise that public awareness and also maybe act as kind of a bit of a springboard for you? So it's already kind of on the up and you can kind of dreadfully mix metaphors of springboards and waves, but kind of ride that wave a little bit.
It certainly did. We also found soon after that there was a lot of investment that was being made to support pathology workforce. But I would say at this point as well that it did draw a lot of attention, but maybe healthcare professionals in general. Still making sure that people were aware of the work we do behind the scenes was probably not being as visible as we would have liked it to be. And that continues to be the case to this day. I know that maybe when I was a student, I didn't really know about anyone who could tell me about this profession. I could look at a prospectus and see there's a course called biomedical science, ask my careers advisor, but there weren't many outreach events happening at the time. And I can certainly see it's improved massively across the years, but it's how we continue to build on that.
Especially with there's some quite innovative stuff going on. Like, do you know the IBMS van that they've got now that can go around to learning and outreach events and taking the lab out on the road? And yeah, there's some very interesting stuff going on there.
I have not had the experience with the lab yet, but certainly heard very positive things. One of the things that we have collaborated with the IBMS on is the use of the virtual reality headsets, the experience of a virtual laboratory. And we have seen how it excites the younger generation. So they really are built for the future technology. And these are the ways we need to start engaging them so they can see biomedical science is not just standing in a lab doing manual work by the Bunsen burner, which is the kind of stuff maybe they get exposed to in colleges and universities. But it's helping them get to see the evolved side of the profession.
Yes. I mean, I think from my work as a magazine editor, one of the most frustrating things is when you go onto a picture library and type in biomedical scientist, then loads of pictures of doctors will turn up and people with stethoscopes. And it's like, whenever they want to portray a health professional, it's like, let's get a person and put a stethoscope around their neck.
Yes.
It must be quite hard to shift that public perception when it's existed for so long. People just think of doctors and nurses, don't they?
It's certainly very hard, but what's very reassuring to see is when we speak to these young people, and majority of the times they will tell us, oh, it's the first time we're hearing about biomedical science as a career. But we do a lot of the times hear them say, this is something I'm really going to seriously consider, or this sounds really exciting to me. I would like to know more. A lot of the times they want to be signposted to resources where they can go away, read more up on it. So it certainly is a profession which has so much value and importance, and it's a very rewarding career. And when you start to speak to young people about it, that's where you can really see the perception shift.
And for biomedical scientists who are listening to this and thinking, the role of practice educator sounds really interesting. You have a typical day. Do you ever go to the labs, or is it mostly remote kind of working, meeting, planning, strategizing? What's the typical workload and day like, Mehwish?
That's a very good question. Probably that's the aspect of the role that I enjoy the most, which is the strategic side of the role. What I enjoy and what I do a lot is looking at the bigger picture and asking questions like where will our future workforce come from? What skills we need in 5 or 10 years? How can we better create opportunities for people to enter and progress within the profession? So when we start to create and develop training programs, we can almost align with, the future direction or the strategy of our organization and the IBMS. My role as a practice educator also has this outward facing aspect. which means I am constantly meeting people from schools, college, universities, NHS England, IBMS, colleagues across other pathology networks. So really that collaboration element is very key to my role, which means a lot of Teams meetings, sending out emails, and using online digital platforms so we can share resources. But I also have a team of practice education facilitators, and I also work closely with our training and development manager. So as a team, we have quite a few workshops or meetings where we do a lot of brainstorming. We talk about challenges, we talk about solutions. I do visit labs, but my role is mainly sitting in an office on a daily basis. It is a hybrid role, so I get to be in the office 3 days a week, and 2 days a week I work from home. I get to visit multiple sites. So my current organization, North West London Pathology, has 7 different hospital sites. So I get to meet our stakeholders from all over, talk to them, listen to them about their challenges, see how things are going, how they're finding our current training offerings. We have a training academy, which has a 17 plus training programs. So it's working together as a team to maintain those programs. And we don't stop there. We're always innovating. So it's thinking about what next? What are the new programs we need to now start working on to make sure we have covered all our staff, regardless of their grade, their discipline, their site. We want everyone to get the best experience from this organization when it comes to training and development, to make sure, going back to our earlier discussions, that we are building a stronger workforce for the future.
And if anyone's listening, kind of regardless of what stage of their career they're at, and they think, I would like to access some of these resources, I would like to get more involved, where would you direct them to?
So I would first direct them to their practice educator. So each network, in majority of the cases, has a practice educator, but they could get in contact with any one of us and we'll be able to signpost them to the practice educator of their network. We have a future NHS platform that's still very much in use, and majority of the resources that we developed for registration portfolios and specialist portfolios still are being hosted there. So we'll be able to give them access, which is a free membership and unlimited access. But yeah, really getting in touch with one of us through LinkedIn, and we'll be able to help you further.
Perfect. Mehwish, thank you so much. A pleasure to chat to you. And well done for keeping all these multiple strands and numerous things in your head, because my head would just collapse if I had to work with so many stakeholders and so many different aspects of the job and data and all the different things you're doing. So you're doing an incredible job. And thank you so much for taking the time to join us today.
Thank you, Rob. It's my pleasure.
Thanks to Mehwish for taking part in this episode, and thank you so much for listening. I hope you enjoyed the podcast, and remember that this episode can be used as reflective learning for your CPD. Please do keep an eye on IBMS social media feeds and the website for future episodes, and thanks again for listening.